So our next session is entitled A Partnership for Health System Strengthening for Safe Abortion Services. Let me take this pleasure in inviting our wonderful speakers for the very session. Our very first speaker for panel number 2 would be Dr. Gampo Dorji. Dr. Dorji works as the Senior Health Policy Advisor at a World Health Organization country office in Nepal. He has more than 20 years of experience in the public health sector, and he holds a doctorate in public health from Boston University in USA, MPH from Johns Hopkins, and MBBS from India. Dr. Gampo Dorji, everybody, a very first speaker. Dr. Saab, on the stage, please. Let's welcome our second speaker. We have Renu Khanna with us. Renu is a passionate advocate for women's health and rights based in Gujarat, India. She is an active member of SRHR movements and coalitions within India, regionally and globally. Renu co-founded a community-based non-profit organization, SAHAS, Society for Health Alternatives, which began various SRHR initiatives from intersectional perspectives. Over the years, Renu has contributed to several UN organizations. Currently, she is a Lancet Commissioner for Gender and Global Health and a member of the Gender Advisory Panel of World Health Organization. We have Renu Khanna with us. Let's invite our third speaker, Caroline Adiambo Naindat. Is a technical expert. Did I pronounce the name correctly? I hope I did. I tried my best. She's a nurse, sociologist, program associate, a leader, and a reproductive and maternal healthcare activist with over 15 years of experience in women's rights and campaigning health system change in Kenya and beyond. She has worked in synergy with the government of Kenya through country leadership to ensure effective rollout of various maternal and reproductive health programs through joint correlation, planning and implementation that has realized a contribution to reduced maternal mortality rates, improved health outcomes for girls and women, and reduced disease burden. Our third speaker, Carolyn, on stage already, everybody. Okay, our fourth speaker, I'd like to invite Dr. Totongon Kosi Rafael from Benin. I'm trying my level best to pronounce the names correctly. Please forgive me if I did an inch of mistake here. Dr. Rafael is a doctor specializing in SSR rights. He is a postgraduate diploma in public health, a permanent state agent for 11 years, was a project program coordinator at Plan International Benin for 9 years, and has been with the National College of Gynecologists and Obstetricians of Benin for 5 years. He has been a committed defender of women's bodily autonomy and has been the recipient of the Feminist Trophy from the Embassy of the Netherlands and in Gender Health in December 2021 and 2024, respectively, for his work on safe abortion, gender-based violence in Benin. Dr. Rafael is here with us already. Now let me invite a moderator for the session. The session is entitled Local Action, Partnerships for Health System Strengthening for Safe Abortion Services. And our moderator is all set towards the stage, Medha Sharma. She would lead the session. And she is the founding president of Visible Impact, a young woman-led organization in Nepal. She has more than 15 years of experience on leadership and movement building with focus on sexual and reproductive health and rights and young people. Medha, stage is all yours now.
Thank you so much, Sugarika, and thanks to the wonderful panelists for joining us today in this conversation. So today we have heard in the room how obviously the funding is shrinking, but also very important message about how it's important for government and non-government actors to work together. And we know that we all are starting to be affected in some way or the other as a part of this larger ecosystem. But ultimately, it's about what happens at the local level where most of the actions are taking place. So we're going to talk and deep dive into that more in this conversation today. Firstly, I would like to turn to you, Dr. Gampo, and with your strong expertise on health system strengthening, I want to know from you how relevant or important it is at this time to discuss about safe abortion from the gender lens. Over to you.
Thank you, Medaji. So in Asia, actually, we let guests speak first. So I'm representing the WHO country office here in Nepal, so I'm a host in many ways. But since you're asking me to lead, I will just open this discussion, right? But I know the experts are here really on the subject, but maybe something to dwell on why health systems is important in this area and what can be done, I think. So again, it's quite obvious in my opinion. The safe abortion services must be based on a very strong foundation of health systems. And if the health systems is not able to cater to the safe abortion services, then obviously you pose, the system will pose a lot of risk to the health of the client and the pregnant female. So it's very, very fundamental. Now, what does it mean by health system strengthening? I think there's a granularity in the context of abortion services. So fundamentally, of course, every component of those 6 systems, health systems, building block is important. And the 7th system, which is not often spoken, is the community themselves and the people around. So I tend to say that even more important is the 7th one, which is the community one. But again, coming back to the traditional systems, health systems, the financing part was quite discussed there. So, but let me just dwell on some of the competencies that you expect the health systems to bear in order to deliver safe abortion services. Just go back to the basics of what the teams in the primary healthcare level or even at the hospital settings should have. The services that should be there, the health workers that they should be fully oriented on what kind of services must they provide when they cater services to the abortion-related services. So it's very important, and maybe the nurses have a different role there. Then who prescribes what, who does what is very important. And at the different level of tiers of health facilities and health systems in public lens, I think, again, there, the service delivery from the point of referrals, because at some point, maybe some of this, they may also require special care. So this transit and referral coordinations are very important. And again, it's a fundamental part of the health system. So at the service delivery level, we have to have a very clear pathway, clear roles identified, and the competencies of these health workers built there. And we saw in Nepal's case, for example, there was a designated, enlisted number of providers and facilities where it's very clear again. And this is a great example of how we actually give the responsibility to designated health service providers and then make them accountable to provide those services. There, I would like to just take a diversion on the public versus private. Again, someone in the panel or earlier mentioned about the need to engage the private providers because that's where I think we lose control over what is provided. So actually engaging, regulating, and ensuring that the private providers also take an equal responsibility as public providers are very important. In Nepal, for example, I understand that the public providers are reimbursed on the number of clients seen. And similarly, there could be such modalities for private providers, but it's actually easier said than done. Come back to the essential medicines that's required. We saw from I think from Kenya, an example of how this was, or Benin, I forgot, that this is already enlisted in the essential medicine list. What that does is that really ensures that those products are actually available at the service delivery. And it's important. It's very important because only then you have those services there. The data, who comes there, record how many people are actually given those services are very important. In Nepal, we saw that the count was going to almost 100,000, which means the number of clients coming and seeking the services are counted. And it's important to have such information. And maybe the competency I mentioned, yes, on the governance from the health systems point of view. Of course, governance at a macro level is very important. And in Nepal's context, there's already a steering committee and technical working group governing, directing on the health, on the safe abortion services. And again, this, of course, was there, but I believe this strengthened from 2019 with the implementation of the SRHR project by the Family Health Welfare Division. And these high-level committees are actually proving to be very fundamental in guiding the overall approach in the country. And likewise, at every level, then you can have those governance mechanisms. So these are some of the fundamental competencies. And yes, the services from abortion to post-abortion, and then post-abortion with family planning services are very important. And these components are not just the competences of the health workers, but the service packages, clarity around there, and how this is delivered is so important. Finally, I'll touch on the quality of services. It's not just the numbers, but how the services are delivered and how these qualities are measured as they deliver in the health systems will be very important. My final point on gender lens. Okay, I think the speakers mentioned and elaborated very well that there's, of course, we cannot undermine. It's not so simple. There's a lot of socio-cultural baggage into this service and so much of stereotyping. And health workforce have to be very, very careful and competent enough to tackle those the stereotypes, stigma, and in order to provide the friendly services to the clients availing services. And it is very, very fundamental and important. So I think I'll stop here because there are other experts who will highlight on this. Thank you.
Thank you so much, Dr. Gampo, for letting us know about various components of health systems and mostly about emphasizing how various stakeholders should come together, highlighting on your community-led leadership and also on the public-private partnership and how we should also emphasize on beyond numbers. So that was very inspiring. And now let's move to India. So over to you, Renu. So then, can I ask you, how can initiatives like this, like Kaleidoscope, going to add value to your work in Gujarat or like broader than that in India?
That's a very, very important question. From our perspective in India, and I think South Asia, if I may venture to speak about more than just my country and my context, I think Kaleidoscope is going to be very valuable on several counts. Firstly, the long-standing, deeply entrenched culture of silence around women's bodies, the shame around women's bodies, the stereotyping that you talked about based on the patriarchal notions of all mothers, all women as mothers, which stigmatizes abortion. This has been our work for decades. And having Kaleidoscope align with our work so closely is definitely an value added. The other point is, so this is a historical perspective, you know, but taking the current context, which many speakers have already spoken about in the first panel, in, you know, and earlier the speakers were saying, the current context is so limiting. It's becoming so difficult to talk about gender, to talk about diversity, to talk about inclusion. And given all of those challenges, I think what we will be doing through Kaleidoscope with friends from other countries across continents is an act of resistance. I think it is a way of countering the backlash which we are all experiencing, women and girls and diverse people in our societies are experiencing. And I think with Kaleidoscope's opportunities and a single sort of pointed focus on making health services sort of friendly, responsive, sensitive, empathetic, is going to be a very big contribution. Having said this, I think also Kaleidoscope's focus on systems, the complexity of systems, stimulating all of us to take a systems perspective, to expand our thinking, to synergize, to link with each other, to analyze subsystems. All of that is going to be extremely valuable. Health system strengthening from a gender transformative perspective, I think is a very, very unique feature of this program. And I think we're going to learn a lot of new things. I think that we are going to contribute to knowledge generation by engaging with this agenda across all of these countries, partner countries. I don't know whether I have time. Okay, let me just say the last thing. I think the solidarities that we will be forging across within our own country, the winning coalitions that we're going to be creating or expanding or strengthening, plus the coming together across 4 countries is going to really sort of increase our solidarity. And that is something that we value a lot. The technical resources, yesterday, the exercise that we did of mapping the resources that we have in the Kaleidoscope Consortium is so, so valuable. And that exercise was so insightful. And I think that is, again, is a value addition to our work in India. And the financial resources, I think, are going to help us to strengthen our coalition. We are part of a coalition called Common Health. The 3 partners from India are members of Common Health. And I look at, this, the Kaleidoscope opportunity to strengthen and expand our coalition and, bring in other campaigns and other movements to work along with us and to have us supporting them. Let me stop here. Taken a lot of time.
Thank you so much, Renu. And as you were speaking, I was also reflecting because I also run a nonprofit here in Nepal, and it seems like we all share the similar resistance. But there's also some anxiety, especially with the local organizations, that all these investments that we have done, investments in terms of time, resources, and everything, to bring bodily autonomy and rights to the forefront, might be diluted, right? Especially when there's a very limited resources. Smaller local organizations that are running with very limited budgets, they might, dilute their work, divert their work to where the resource goes. And this is why, local organizations are very vulnerable. But I think also that, if we look at the value for money and resource justice that earlier panel also discussed about, through initiative like this, Kaleidoscope. In Nepal also, I really hope that with this partnership with the government, we can bring the best value for money for everyone. But thank you so much for sharing the context in India. So, Caroline, over to you. So again, how has this change in the global ecosystem and the funding ecosystem, has it affected your work at the local level in Kenya?
Thank you very much, and thank you for allowing me be in this panel. We know that in the current global space, and Africa is not excluded, the funding reduction has actually brought in a lot of restrictions in terms of policies and reallocation in terms of our operations. And this has brought in a few of challenges. We know that for us in Kenya, the government solely got bilateral funding from many of the donors, and that clear cut has disrupted our operations in terms of service provision. And so you find that there is reduced access to services. I'm talking in reference to this as a service provider, and more so in the rural areas, where you find that in terms of human resource, there is then those staff that then have gone home because there are no funds to actually sustain them. And that is straining the operations of the human resource. So that indeed also affects quality of service provision. And here I'm talking about in reference to quality safe abortion care services or post-abortion care services. And we know, as my colleague has mentioned, quality is key in health system. And so there is also that need for us to reconsider as Kenya how we would locally look at resource allocation in terms of advocating for resource allocation in maternal and reproductive health. The other bit that we are experiencing is aspects in terms of weekend partnership. So with restrictions, there are then policies in terms of what local organizations can do in terms of their programming. So you will find that the comprehensiveness in terms of the funding has reduced. And so there is that disengagement in terms of integration in our programming. So you will find that either when you are synergizing with a local entity in provision of certain, let's say, family planning versus safe abortion care provision, one entity might be told that we would not want our funds to be used for abortion care. And so that then weakens the culture of partnership among the local entities. And this goes down to also facilities in terms of service provision, where you'll find that then services are dismantled and there's no that integration. And that creates opportunities of near misses. So if you are looking at then the safe motherhood pillars, then a client or a woman would leave a facility not really comprehensively served in terms of quality service provisions. However, if I flip it, you'll find that this has taught us as Kenya that there is need for us to look at domestic resource mobilization, where we don't only depend on the international funding opportunities, but also local funding opportunities within the country. How would we then tap on other sectors? If you're looking at the banks in terms of supporting, how do we engage in the multi-sectoral spectrum, where we are not only looking at health, but we're also looking at other ministerial, agriculture, we are looking at sports, we are looking at gender in terms of our implementation. Then last but not least, ensuring that then we strengthen our partnership. So I'm looking at the lessons that we have learned with the funding cut to really also advance our engagement. And currently we are ensuring that advocacy in terms of engaging the parliamentarians in allocating budgets to advance our SRH service provision. So that's what I would say for now.
Thank you so much, Caroline, for sharing how your work has been affected, but also sharing that through other strategies like partnerships and mobilizing domestic funding, we will still try to ensure that there is quality in the services that we provide. So thank you so much for emphasizing on that. Now I'm turning to you, Dr. Rafael. So I want to hear from you as well. How can initiatives like Kaleidoscope add value to the work that you are doing in Benin? And just to let everyone know that Dr. Rafael will be speaking in French. To you.
Good evening, everyone. Bonsoir tout le monde.
Good evening, everybody. Good evening.
Moi, c'est Dr. Raphaël.
So my name is Dr. Raphael,
Je viens représenter le
and
consortium
I am representing
implémenter le
consortium
projet
here,
Kaleidoscope
which
au Bénin.
will implement the Kaleidoscope initiatives in Benin.
Avant de répondre à la question qui est dite,
And before replying to the
quel sera
question
l'impact du
that
projet
was asked to me,
Kaleidoscope
what
au
will
Bénin?
be the impact and the effect of
Je voudrais
Kaleidoscope
planter un peu le
in
décor
Benin, I would like to
en faisant une
first
synthèse.
set some setting, and and I would like to provide a synthesis of
Le Bénin,
what
comme la plupart des
happens
pays
in
membres
Benin.
des Nations Unies,
In
est
Benin,
tenu par
just like
l'agenda
other countries
2030.
which are members of United Nations, we are respecting Agenda
Et par rapport à
2030.
cet agenda, nous avons des
And
indicateurs
with
de santé
regard to that
maternelle
agenda, we have
qui sont
also
des
indicators
logos
for maternal
et qui vont
mortality
couvrir tous les pays, surtout en matière de réduction de
and
la mortalité maternelle.
to reduce this mortality rate.
UNFPA a dit que pour
And the
accélérer la
NFPA
réduction de
said
la mortalité
that we
maternelle
will
dans un pays,
accelerate
il faut agir sur trois résultats transformateurs.
to reduce the mortality
Zéro décès
rate
maternel
in
évitable.
countries.
Zéro
And
besoin non couvert en
zéro
pénétration familiale et zéro violence basée
of
sur le genre.
zero violence against women, zero cases of violations against women. That is the aim and objective.
Mon pays, le Bénin, à
My
travers son
country,
gouvernement
Benin,
et son plan
is
d'action
working with the
pour d'ici
government,
2030
and we have an
a
action
un axe
plan
stratégique,
for
l'axe numéro 2,
2030, and
veut
to create we have created a
prendre de
strategy
l'importance sur toutes les stratégies
to
qui permettront de
give
réduire la mortalité maternelle au Bénin.
to develop all these strategies that will help reduce the
Le
maternal
ministère de la
mortality
Santé
rate in Benin.
s'est doté
And the
d'un
Health
plan opérationnel de
Ministry in
réduction de la
Benin
mortalité maternelle
is
et
now
néonatale
endowed with all the tools to
2018-2027.
reduce has created this plan of 2018-2025 to
Dans un plan
reduce maternal
d'autres
mortality
initiatives
and the mortality
au
of
financement qui
newborns.
permettrait d'agir
And
sur les facteurs qui entretiennent la mortalité maternelle sont les
all
bienvenus.
the factors that can help reduce this rate
En
are
2021,
welcome in
le
Benin.
Bénin a une
In
nouvelle loi
2021,
sur
Benin
la santé
also passed a
reproductive
new
qui
law
augmente
about
les chances d'accès à l'avortement
sexual and
sécurisé aux
reproductive
femmes qui
health
vivent une grossesse non désirée.
for helping women get rid
lendemain
of
du vote de
abortions,
cette loi,
get rid of pregnancies which were not
soit juste un mois après,
wanted, which were
le
unwanted.
Bénin a tenu
And Benin
une assemblée nationale
has
pour
also
évaluer
created a
l'écosystème de
national
l'avortement
assembly
dans
to
notre pays.
evaluate the ecosystem of abortions in the country.
L'écosystème de l'avortement dans notre pays repose sur 8 piliers
And
fondamentaux.
ecosystem of abortion in the
Entre
country is very
les normes et les
fundamental.
valeurs, les politiques et
And
la législation, les
in
ressources
addition to
humaines,
that,
le
we
système
have
de santé,
policies,
le
the human
financement,
resources,
le
the
supply chain, la
health
gestion de
system,
l'information,
the
and so on. 8
supply
piliers fondamentaux.
chain, and these are all the pillars,
C'est
fundamental
ainsi que
pillars.
mon pays s'est doté, voilà, a eu un
And my
programme
country
génial financé
is
par un bailleur
now
anonyme
equipped with
qu'on
a
appelle
very
initiative
with a great program
SHRAR.
which we call
Ce programme
SRHR program.
a
This
3 axes
program
stratégiques.
has
Un axe
three strategic
qui est dénommé
axes.
combattre les décès
First
liés
of
aux
all, how to
hémorragies du postpartum.
combat the postpartum
Un
hemorrhages,
axe qui est
and also
l'avortement
one
sécurisé et le troisième
orientation
axe de ce
is
document
to provide
est
safe
la
abortion.
planification
That is
familiale,
also part
comment
of this
faire pour
document.
tendre vers les
And
objectifs de
also
2030 en matière de
family
planification
planning.
familiale.
Family planning.
Ainsi,
So these are the three main
parmi les 8 piliers
axes.
fondamentaux sur lesquels repose l'avortement
And also
sécurisé dans un pays,
the abortion, safe abortion in our
Kaleidoscope
country
s'est
depends on all
positionné
the
à travers
actors.
le projet
And the
3 ans de grandes œuvres de
initiative,
marée d'expérimentation
Kaleidoscope
sur
initiative will help
5
in
piliers sur les 8.
implementing these
Je
and
dois vous
help
demander à vous tous
strengthen
d'applaudir pour le projet
these
Kaleidoscope.
axes, these
On applaudit pour le projet
programs
Kaleidoscope au
that we
Bénin.
already have in the country. And so Kaleidoscope is a very great initiative for Benin to help internal programs. My colleague, Dr. Edith, is also present here, who represented the ministry from Benin. She talked about the main points, about the valors that help ensuring safe abortion in our country. Kaleidoscope is part of the strategy that will help us reduce stigmatization in the country, which is also very important. Another avenue where it will help us is the capacity building for safe abortion for the health service providers. Another avenue is that improvement of the capacities of our colleagues in providing safe abortion. And of course, it is another domain which is related to it is advocacy work. And advocacy work is equally important. And Kaleidoscope, as an initiative, is helping in strengthening all these domains, all these axes, and also in strengthening the impact of the project. And so we are here, we are representing the Ministry of Health from Benin, and we appreciate this initiative. Thank you very much.
Thank you so much, Dr. Raphael, for sharing with us how Benin has been making progress and how initiative like Kaleidoscope will be a great addition to some of the strategies that you have developed at Benin. So I know we planned this to be a rapid fire panel, but I know that we still are good with time. So I want to take this opportunity to go through a quick second round of questions, and in a very, maybe less than 2 minutes, can you all share, it's the same question for all of you, what does a successful local partnership look like to you? Because this session is about local partnership. So yeah, what does a successful local partnership look like for you? So maybe we can start with you, Dr. Gampo.
So having a safe abortion services, I think, should rely on a very strong partnership and collaboration across many sectors, right? So it's not just health workers giving the service. You need resources for this. You need political will and commitment. You also need civil society and groups to champion for this cause. So we will have to actually tap on this, and most importantly, also the resources, financial resources for this. And again, in many settings, it doesn't come from one source alone. So we will have to mobilize this from various sources. Most importantly, we need a common spirit and a collective force. And we need to tap, for example, in a country like Nepal, it's quite amazing, I would say, from WHO perspective, that there is such an intense collaboration from the grassroots, from the communities to the civil society groups, and the Ministry of Health leading this cause. So I think we will have to rely on this and on this kind of partnership and collaboration. And one more last thing is that having a community of practice, not only in the country, but across the countries, learning from each other. For example, the Kaleidoscope initiative really sets the tone to learn from each other, because today it's very easy and we must optimize on the digital approach and also the cross borders to learn from each other. So I think the 4 countries that are here can really now break the barriers, look at it together, and learn from each other. So I think partnership of learning from each other from countries is also very important. Thank you.
Thank you. So I was thinking that for me, a successful local partnership would have at least 3. It's a triangle. It's a triangle and the first and the most important constituency there is representatives of marginalized communities who are participating, equally with people like us who are facilitators. You know, we are NGOs, we are facilitators. We, in the short term, speak on behalf of marginalized communities, but we should be very clear that it's short term. In the longer term, they have to, you know, our job is to facilitate their active participation in their agency. And the third prong of this triangle is the duty bearers, the service providers, the health officers, administrators. So it's a three-pronged approach for me, where the aim and the vision is the same, which means that the most marginalized communities are serviced in the most sympathetic, empathetic, responsive manner. That's one. So there's a common aim and a common vision. The second part is a woman-centered approach and perspective, which means that all women and girls in their diverse, so women frontline workers, for instance, are also part of or have the same struggles as community women, given their own context of families, communities, their professional hierarchies, where power relations are rampant. And so there would be a consideration for women frontline workers, women within the health system, women's leadership within the health system, etc. You know, so that would be another thing. And supporting each other and transparency and accountability. I think these would be elements of strong, sustainable local partnership for me. Thank you.
Thank you. Definitely, local partnerships for local solutions. And we are ensuring that then we engage the locals without forgetting the states and non-state actors. And that's why we, as Kenya, we have ensured that then we have the Ministry of Health take the driver's seat in having system change, while as partners, we are then facilitating the process. So for us, when we have a local partnership with unified culture, with a winning collusion, we'll be able to have that system change that Kaleidoscope wants to have. And so for us, our local solutions will be county-led, county-driven, partner facilitating. So that's what we are looking at in terms of local partnerships.
Same question to you, Dr. Raphael.
Merci. J'essaierai d'être bref.
I'll try to be very short.
Tout à l'heure, quand je citais les 8 piliers sur lesquels
When I spoke about the 8 pillars, I spoke about finance, funding.
Afin de maximiser l'impact
in order to maximize the impact of funding, in Benin, we have a platform of health services in PPP model. So this is where all the funding for the health system will be listed in a strategic, at a strategic level. In this platform, we will analyze the priority needs of the country and the possibilities of funding which comes. Most of the time, it's always done by consensus that this should be directed to the most priority needs. And safe abortion will be part of this. We spoke about consolidating health services, a project which is funded by Netherlands. We are used to having collaboration between all the financial interventions, and we also mobilize resources domestically. I think this is very nice in order to make it sustainable so that it can continue over a long time. So the basis of long-term financing is consolidation of domestic funding also. Thank you very much.
Thank you so much, Dr. Raphael, and thank you so much, everyone. I hope it was a very rich, enriching conversation. And thank you so much for sharing how important it is to work with local partnership and build this partnership and sharing about your work in your respective countries. Thank you so much once again. And can I request you to take a seat back? Thank you so much once again.